Good morning, everyone, and thank you for coming. Most of you know I'm Rebecca Olson. I'm the Executive Director of the OABC. Please note, I think you heard the sound that this session is being recorded today for those who couldn't make it. On behalf of the OABC Board of Directors, I'd like to thank each of you here today for taking the time to join us. I know some of us are feeling a bit zoomed out, but in the absence of physical events, we are thankful for the technology and the opportunity to still discuss important topics together at such a time as this. I'd like to begin by thanking today's partner and our co-host for today's event, which is Cigna. More on this to come, but we want to say thanks to the whole team, especially Raed, Anthony, and Zena, for preparing such an important session. So we're really looking forward to hearing from you in just a few minutes. We also have Q&A during today's event. So we encourage you to please type questions in the chat box, even during the session, if something comes to your mind, to be discussed at the end of the presentation. This next slide with our premium member logos, it usually goes up at our in-person events. We'd all be mingling. Raed and I were just speaking. We'd be having a coffee, chocolate croissant. Anyway, we're not doing that, but usually we put this up during the time to give visibility, special appreciation to each of these companies, because this is still an important thing to do, even though we're meeting digitally. They really sponsor the work of the OABC at the highest possible level. So the OABC is able to continue our important work because of the contribution and support of these premium members. So thank you to each of you if you're here today. Now, before we get started, it's my honor to share a brief introduction to our speaker, Mr. Raed Alabaki. Raed is the General Manager of Cigna Insurance Middle East, and he's responsible for designing strategy and setting key goals for growing the company's business operations in Lebanon, Kuwait, Oman, and Bahrain. In addition, he's tasked with controlling budgets and optimizing expenditure in the territories under his purview, and with facilitating employee motivation and well-being to maximize productivity. I'm sure we'll hear about that today. Raed brings to his role over 25 years of experience in market management, bank assurance operations, sales, and corporate communications. And prior to joining Cigna, Raed was associated with Alliance SNA for 20 years in Lebanon, holding several leadership roles. Once again, thank you, Raed, and the team at Cigna for your willingness to address the OABC membership at our first event together. We're all looking forward to what you have to say. I'll hand over the floor to you.
Thank you very much, Rebecca. Good day, everyone. And thank you, Rebecca, again for the introduction. It's really a pleasure to be among you today. As you said, I would have loved to be mingling with the participants before, as we used to do before. Hopefully, in a few months' time, we will be able to do it, and we will be together in Muscat. As new members to the OABC, we are very excited to start connecting with all the member companies in Oman. And on behalf of everyone at Cigna, I would like to thank you for joining us today to this important session, as we will be sharing the learnings of the COVID-19 Global Impact Study that was undertaken by Cigna. Today, we are going to focus on how businesses have received an increased risk and the negative impact from the COVID-19, and particularly on employee mental health. And what are some of the positive steps that corporates and leaders can take in order to safeguard their most critical asset of their business, which is their employees, by enhancing workforce productivity and success. Offering a deeper perspective on this is our Cigna COVID-19 Global Impact Study, which we've conducted in 5 phases, and we continue to conduct in 5 phases in 2020 to stay informed of the people's well-being and assets. We will discuss some highlights of this survey and the importance of creating a culture of mental health, stress management, and overall well-being of our employees to create and maintain a healthy and productive work environment, thereby reversing the impact of the pandemic. As you know, economies around the world are now slowly getting back to normal, but work environment has transformed irrevocably. Therefore, the importance of well-being, physical and mental health of each and every employee has become the cornerstone of business survival and success. But before going deeper in this, let me first share a brief introduction about Cigna and our presence in this region of the world. Next slide, please. Thank you. For more than 200 years, Cigna has been helping people across the globe to live healthier and have more secure lives. Today, it is recognized as one of the leading providers of health services and solutions to individuals, employers, and governments. Today, we are serving over 175 million customer relationships through more than 70,000 employees in 30 countries and jurisdictions. I am also happy to share with you that last year, with over $160 billion in adjusted revenues, Cigna moved 52 spots up on the Fortune 500 list to become number 13. Next slide, please. Thank you. As for the Middle East, we have been present in this region for more than 17 years, where we actually started first by serving our global clients present in the region. However, since 2017 and the acquisition of Zurich Insurance Middle East, we became fully operational in the region with operations in the UAE, in Saudi Arabia, in Oman, in Kuwait, in Lebanon, and in Bahrain. We are now serving over 800 clients and 150,000 members across the region through a network of 6,500 medical providers. And Cigna is now one of the top 5 health insurance providers in the region and one of the fastest growing. In Oman in particular, we operate locally through our Oman branch, and we do provide solutions for both corporate and SME through our local team in Oman, and our head office is in Muscat. Next slide, please. Thank you very much. While the region is teaming up with new opportunities, it is vital for us to understand the challenges that our employees are facing. As you know, COVID-19 pandemic has created a new reality of remote working and making us connect like never before. We had to learn new ways of living, of connecting, of interacting, and this has strongly increased the levels of stress and anxiety. As you know, stress can cause physical illness. It can also lead to burnout among employees. It impacts both their personal and their professional lives. At work, it can lead to absenteeism and lower engagement and productivity levels. Think about the working parents and how hard it is for them. They must balance between working from home and schooling from home, often with little or no help at all. Add to this, of course, the loneliness caused by the reduced human interaction. Moreover, many are struggling with the underlying fear of getting redundant, and this adds to the pressure to always be accessible and connected. In such times, it is only normal that employees will look up for support and guidance from their leaders. And therefore, the role of the companies is to be more present now for their employees and perform regular check-ins on their needs and on well-being. Next slide, please. Thank you. But to be able to support our teams, we need first to understand where they stand. This is where the Cigna COVID-19 Global Impact Study helps us understand the personal health and well-being of our clients and members. Actually, every year, we conduct an annual survey to measure the people's perception about health and well-being. However, this year, with the pandemic situation, we conducted our survey both before and after the stay-at-home period. The study was conducted across major cities and countries of the world to see how various populations are coping with the pandemic. It measured 5 key indices: physical, social, family, financial, and work. And it was conducted in 5 phases, starting from January 2020 at the pre-pandemic time and stretching across April, June, August, October, and lastly, December 2020, with results published in January 2021. This year, we also focused on topics such as stress management and workplace preference, and the results were insightful to say the least. So let's take a look now at some of the key findings. As you can see on the slide, the Middle East Health Index performed well with 67.4%. The previous slide, please. Thank you. With 67.4 points against the global average of 60.9 points, demonstrating the resilience of this region. Next slide. On this slide, we can see the evolution of the results of each of the 5 indices between the first and the last wave of the study. It shows us that as we continue to thrive through lockdown and restrictions, people are actually craving for normalcy. The vaccine rollout and the positive business feeling across the Middle East has resulted in a growth in all 5 indices from pre-pandemic level to end of December 2020, which is actually very positive. Even the financial sentiment, as you can see, and which remained low throughout the pandemic, has witnessed an increase at the start of 2021. Let's move to the next slide, please. However, as you will see on the bottom chart, stress levels are unfortunately higher in the Middle East than in other parts of the world, than anywhere else in the world. This higher stress level has been a recurring feature for employees in the region since 2017. With longer working hours, the always-on culture continues to prevail, even while working from home, and leading to an increase in stress. Close to 95% of the Middle East respondents claims to have an always-on culture, as opposed to a global average of 78%. This is a huge difference. 71% of the Middle East respondents say they work longer hours, as opposed to a global average of 47%, also a huge difference. This trend has also drastically increased, as it was 63% in January 2020. We do have a stress-related issue. It is obvious. More Middle East respondents are also working on weekends, with 53% compared to the global average of 47%. Only US respondents claim to work more on weekends, with 58%. Next slide. Now, if we look at the employee expectations, what did they tell us? What did we hear from the voice of the employees? A majority of participants expect more mental health support from their employers. 64% seek more flexibility at work. However, only 37% are receiving it. So the support is not up to the level of the expectations. Unsurprisingly, health and well-being remained a continued priority for employees, with 74% seeking enhanced health coverage. However, only 28% admitted receiving it. 74% seeking for enhanced health coverage, but only 28% admitted receiving it. Mental health support from employers showed a continued decline through the phase of the study, unfortunately. Only 29% of the employees claimed to receive support in 2021. This is a decline from 34% recorded in June 2020. So they are telling us what they need. Next slide, please. Let's now take a closer look at the work policy, which is very important. We have seen from previous reports that remote working in response to the pandemic was very successful for both employers and employees. With companies and organizations facilitating more remote working in 2020, it is now obvious that hybrid work environment is likely to be the outcome of this pandemic. This was the sentiment of the employees as well, with 72% preferring a new hybrid style of working, 72%. This was also reflected in the policies implemented by organizations across the world, as they have transformed their offices into collaborative spaces. And this is including our own offices at Cigna Middle East. Indeed, our offices have been repurposed to include greater collaborative spaces, and our employees are now encouraged to split their time between the office and their home on a 50-50 basis and on voluntary basis. Next slide, please. Another interesting finding from this study was how the people approached the access to healthcare. Remarkably, virtual health is now widely requested as part of typical healthcare. We've seen it and we've heard it. 77% say they would choose to have a diagnosis virtually. And when asked about how likely they would use virtual care to connect with their own regular doctor, it increased to a remarkable 88%. Also, the trend towards usage of health and well-being apps is set to continue because 79% said they would consider or prefer virtual engagement when it comes to general health advice, such as nutrition and lifestyle tips. We also see interest in virtual health for mental health support. 61% said they would consider or prefer virtual consultations for mental health support. Next slide, please. So this brings us to the $1 million question. What will be the new normal from now on? As we enter a new world, we will observe changes in habits and behaviors of consumers around us, of course. Unsurprisingly, the survey revealed that people will continue to pay more attention to their mental and physical health. In fact, majority of participants, 53%, as you can see on the slide, will be more alert about the coverage of their healthcare plans, more alert on their healthcare plans. It is therefore clear now that this pandemic has significantly increased concerns around physical well-being and health. But the key highlight that I want to leave you with is this one. 34% see changes in how they will manage their work, and 40% in how they will manage their health. This is the core behavioral shift created by the pandemic. Employees have obviously become more aware of mental health needs and how they will manage their health going forward. Next slide, please. Now that we have seen some critical insights on employee health and well-being, what can we do as employers to help our workforce? We heard them, we need to help them. As leaders, we should start by asking ourselves, do wellness programs, do workforce wellness programs really make a difference? Well, the answer is simply yes. There is an abundance, we have an abundance of evidence that the workforce that has access to well-being resources will be more productive. Therefore, focusing on well-being of employees will only lead us to a happier and more productive workforce with greater business outcomes. Next slide, please. Concretely, what can we do to support our employees? First, you know it, communicate. Communicate frequently and more and more. Communication is simply one of the most effective tools in employee management. It is key not only to overcome the fear that comes from misinformation, but also to show them that we care for them and we care for their well-being. Our study showed that 64% agreed that working from home and using technologies to communicate has improved their connections with their colleagues. Second, set a priority team. It's easy. Your HR department can put in place priority teams to ensure smooth workflow during the crisis, while managing employees, of course, fairly and effectively. What does this mean? This will include check-ins and monitoring of employee health and well-being, regular emails offering healthy work from home tips, and supporting policies and practices. It works. Virtual access to care. We heard the respondents that they are ready and they want to use more virtual healthcare. By enabling this access to your employees, you can ensure that they will have access to healthcare more easily. I'd like to remind you that 79% of the respondents said that they are likely to get virtual health consultations. To this end, we have launched at Cigna a webinar series, Connect for Health, which brings a healthcare expert to consult on various aspects impacting our health and our well-being. Companies must also have their employee wellness packages tailored to their own needs. A priority offering is telehealth. Telehealth is really becoming a major tool to ensure immediate access to quality healthcare. Overall, 86% of the respondents said that they are encouraged to use telehealth consultation. This telehealth is the new name of the game. Also, very important to maintain a sense of future for our teams, for our employees. Maintain a sense of continuity by continuing to execute on our roadmaps and strategic planning. Give our employees a view of the plans to transition back to normal, because we need to show them the light at the end of the tunnel. This is how we can manage their stress. Last but not least, of course, invest in training. The pandemic has transformed the world. It has also transformed the job market. While it has redefined the way we work, it also raised the need for new skills. A recent McKinsey report has shown that almost 9 of 10 executives and managers say their organization is either facing skill gaps already or expecting such gaps within the next 5 years. Your HR team can lead this initiative and build training plans for various work functions, benefiting not just the employee, but the whole organization as well. Moreover, reputed global platforms such as Harvard University and LinkedIn have made courses available free online to support learning for individuals and companies. Let's move to our last slide, please. Thank you. Finally, what can we at Cigna do for you? Well, we have tailored our capabilities in order to support our clients and their employees via a robust suite of emotional well-being offerings. First one is our Cigna Employee Assistance Program, the EAP, which is quite complete. It includes typical counseling, online cognitive behavioral therapy, mindfulness programs, work-life balance services, and seminars that can be arranged to a group of your employees and that can be done remotely. Believe me, it is more and more demanded since the beginning of the pandemic. We have clients, we have brokers contacting us only to know if we provide employee assistance program, which we do. Now, for individuals who might need minor support, we have online programs to help them improve their resilience and reduce their stress level. Take, for example, the One Small Change tool, which can help us by start doing one small change at a time in our daily life, in how we work, to have more healthy and more work-life balance. The third one is our telehealth services, which I mentioned before. It is particularly helpful now because many people are stressed about the access to healthcare in the current situation. You know that we have the stress of going to healthcare providers due to the COVID-19 situation. Therefore, the telehealth can be the first step for those who may be suffering from anxiety, from depression and need to speak to a practitioner. Needless to mention that all our doctors are certified practitioners who are able to assess such stress and anxiety symptoms. Finally, we have a lot of content at Cigna that address emotional well-being and mental wellness. We also released a series of articles covering the current situation, such as loneliness and work from home. These are our solutions to help you help your employees, and they are all available in remote setting to make them effective during the current pandemic situation. With that, I am reaching the end of my presentation. Thank you very much for listening, and I look forward to having your questions. Thank you.
Thank you so much. You know, the plan was to have our members type them into the chat, but I think if anyone is interested to just ask a question, there's this cool raise your hand feature on Zoom. It's not the same as real life, but if you do that, our team will see you and you can unmute and go ahead and ask Raed your question personally. I have lots of questions, but I'll wait just a minute. And maybe you can also send me directly a chat in a private message and send me questions that way as well. And I can read them for you if you prefer. You know, as we wait, real quick, I said I would wait, but do we have any idea why the Middle East was so much higher than the rest of the world when it came to stress and working on weekends? And because that even that orange line, it wasn't really the average. It was the average which was thrown off by the Middle East. So do we know why that is?
Absolutely, Rebecca. I think that unfortunately we are behind in these stress management and mental health awareness. And it's not yet for us in the Middle East, it's not yet okay to not to be okay. It is a mentality, it is a culture. Add to this maybe the fact that we have a lot of expats and, you know, a lot of pressure on expats during the pandemic, not being able to go to their home country, not being able to see their families. All this has made, I think, the level of stress higher in the Middle East. And this is why we want, together with you, with the AmCham, with the participating companies, we want to raise this awareness on mental health, on stress management. We want to help our employees and our environment to deal with stress.
Very good. Thank you. I do have a question here in the chat.
Sure.
I can get to the chat. All right. How confident are you that the feedback you have from those surveyed is representative of the true impact at the grassroots employee levels who are the most impacted by this, who reduced, or in some cases, there's no pay and no safety net?
Yeah. Yes, definitely. Very good question. Actually, as I mentioned, it is not the first time that we do this survey. Excuse me. We've been doing this survey for several years as part of the 360 global survey done by Cigna. This year, what was new is that we did it across phases, across 5 phases, as I mentioned. And we started doing it in January at pre-pandemic level up till December. This is because we wanted to be confident. We wanted to make sure that we are not only recording the responses at a certain point of time where they can be impacted or influenced by recent developments, by a lockdown, for example, or by a peak in the number of cases. So when we do this survey, up to 25,000 people, this is what we did all around the world, up to 25,000 people, and up to 1,000 people in the Middle East, and doing it in 5 phases during 1 year. Again, January, April, June, August, October, and December. And when we are measuring 5 indices that I mentioned previously and doing the average later on, this is what makes us confident that we can trust the results that we have. Now, it's not maybe up to 100%, but to a high level of confidence, I can say. I hope I answered the question.
Thank you. I think if there's more, we'll see those in the chat. I've also received some Actually, can you tell us more about how Cigna as a company is adapting a hybrid work situation? What does it look like for you and your team?
Yes, it is hybrid in the currently. It has been, of course, fully working from home in the beginning. You know, in the beginning, we had this stamina, we had this excitement about the fact that we can work from home, that we can have more time with our families, but we were also working very late hours. Then we got a staggered approach towards going back to the office. First, because the team, they want it. I have a lot of my colleagues, they tell me, I want to go to the office, not because I need to do something from the office, but because I feel better. I want to wake up in the morning, get dressed, take my car, see the city, see the light, meet one colleague, for example. So now we are doing flexible arrangements on voluntary basis. Now we're back on 20% basis. Again, I repeat, on voluntary basis. And our plan is to move up to 50% from now till September. And in this purpose, we have reduced our office space, the number of stations, for example, but we have made a more collaborative working space for the colleagues. And most probably, Rebecca, we will ask the colleagues to come at least once per week, for example, to the office, because we need them to still have this belonging feeling to the enterprise, to still mingle with each other, to have meetings, to brainstorm, and so on.
Interesting. So when you say for space for collaboration, for example, if you had a small office and there were mostly desks close together, you might spread those out because
Yes.
You can do your work at home, but it's what you come into the office to collaborate.
Yes, absolutely. And this can change. Yes, instead of having only desks, we will have couches, we will have more meeting rooms. You know, it will not be anymore, this is my desk. No, it's a collaborative space where Raed can sit today here, Rebecca can sit tomorrow here, for example.
Okay, interesting. There's another question I've received here about virtual healthcare. I think according to these statistics, you've seen a shift that way. I just have a question about as well. This question is just, have you seen the shift? But I think I'll let you speak to it. I also would like to know, is there a savings involved at all for the employer? If someone is not going into the hospital, is there any sort of, I guess, are they saving time? What are the other benefits of online healthcare besides people are enjoying doing it from home? What are the main benefits?
Yes. Why they like it, actually? Very good question, Rebecca. Well, first, you know, because of the concern and fear from the pandemic. That's the first one. Because we want to avoid going to a hospital, going to visit a clinic, because we are afraid of getting contaminated. This is particular to this current situation. But let's say in general, first, you have the easiness of doing it at your own time. You can, by the way, telehealth and virtual health is available 24 hours. You can get a consultation at 3 a.m. in the morning. You don't need to take out of your time. You don't need to go out, take a car, get in the traffic jam, wait in the waiting room for hours and hours at the doctor's waiting room. All this, you can do it virtually. And you'll be at your ease. And you know, today with the video enabled consultations, wherever the law, wherever it's compliant, because in some countries, video consultations are not allowed. But whenever is allowed, is also very easy today, where with your camera, you can show your doctor things that you need to show him. And that's why we really have observed a massive jump in the downloads of our wellbeing app. It went from 70% in Q1 2020 to 412% in Q2 2020. Why? Because people, they want to use virtual health, and to use it, they need the virtual app that we are providing.
Wow.
One more last figure, Rebecca, on this. Globally, our customers logged into 90,000 times in 2020 to our digital virtual health. 147,000 times since it was launched in 2018. So it was 147,000 times in 2 to 3 years. It is 90,000 in less than 1 year now. So you can see people, they want to use it more and more.
Just out of curiosity, does it start with a chat? Are you like WhatsApping, texting someone, and then it can become video, or how does the app interface with the users?
Well, Rebecca, it's up to the user. It can be just a call, or it can be a video chatting. And very important to mention that we as Cigna, as providers of this app, as providers of this service, we are completely out of this. Whenever you use this function on our digital support, you will be redirected to our, for example, Teladoc or other providers. And we don't have any idea about what is going on. This is completely confidential. This is completely anonymous. So they can get a second opinion. They can get a consultation. It might save them from a surgery. It might comfort them in their decision to take a medical decision. And this is, again, I repeat, we are completely out of this cycle. We don't know what happened at all between our member and the practitioner.
Yeah, that's a very important point, because some people were afraid to, upload or do things online. It's a really important point. We have a hand raised. I'm so glad. Fatin Al-Busaidi, I am asking you to unmute so you can ask.
Yes, thanks OABC for organizing this session. Also, thank you to Raed for his presentation. I have a question about the stigma that is occurring in the Middle East towards mental health. So Raed, you mentioned that it's still not okay to not be okay here. So what are your opinions in reducing the stigma? And even if we are offering employees with benefits that target mental health, the acceptance of these offers is not that high. So what are your thoughts on this and how we can try to reduce that stigma?
Thank you very much. Yes, indeed, you're absolutely right. We've even noticed that when we have started using the tools which I described to you previously, we had to insist sometimes. We had to follow up in order to have our own team using them. So I think the best way is to really focus on it, give it more time, invite employees, show them success stories on how it helped some of them or some of our members. Like, for example, in the town hall meetings that we do for our team, we invite members or we invite colleagues that on voluntary basis accept to testify on what did they use among our services, the services that I mentioned, and how did this improve their mental health, how it has improved their stress levels. I think when I will be seeing other colleagues doing it and sharing how beneficial it was for them and for their mental health, I will be encouraged. Also, as I mentioned in our Connect for Health webinars, we have invited experts who really explain to us the importance and how important it is to do it and how beneficial it can be. Bringing an expert and making webinars for your team to explain to them that it is okay to be okay. And they would give examples, and usually they are sincere and they are brilliant. They give examples about themselves. They give examples about people they know. And then you start relating, you start comparing yourself to the others. And again, you will feel that it's okay. Others have had this issue. I have it. He solved it. She solved it. I can solve it as well.
Okay. Thank you. We have another question from Khalil. Some believe that each economic situation related to the epidemic has side damages related to work or employees, and others call it a health economic situation for the sake of change. What is your advice in these terms and its reflection on the psychology of the employees?
Yes. Indeed, the name is pandemic. So even if others call it health economic situation, it is The name is a pandemic, and yes, it is affecting the health, the sanitary situation, and it is affecting the economy at the same time. And this is where the governments were really struggling, and we have to understand, because it was a very difficult balance. The more you put restrictions, the more you lock down the country, the more you will impact negatively the economy. And then the more you open up in order to boost the economy a little bit, number of cases were peaking. That was before. Hopefully it doesn't seem to be the case now. Let's touch wood and cross our fingers. So here was the very difficult dilemma in this. I would continue calling it a pandemic with an impact on the economy. That's how I would personally call it. And the reflection on the psychology of the employees, well, you know, there are different situations. I mean, yes, it is difficult for all the employees, but let's be honest, someone who still has his job and getting his income, it is less difficult on his psychology than someone who might be losing his job. And the big effect on the psychology of employees is indeed the fear of losing the job. We all know that a lot of colleagues have been answering emails at 11 p.m. which were not urgent at all. That in normal days, that pre-pandemic, before the pandemic, they wouldn't have answered the email. They were opening their laptops. They were always connected. They wanted to answer each and every email. You might say that this is because they are locked down, because they are staying at home. Maybe, but believe me, the real reason is the fear of instability, the fear of uncertainty. I want to defend my job and protect it. And this has a big impact on the psychology of employees. And I mentioned this before. And this is why I will not take much more time on this one. This is why I said that it's important to give a sense of the future, to give a sense of continuity, to show our team that our business is doing well, that our company is doing well, that we have projects for the future, that we want to embark. They are the core of this project, and we need them for this project, so they can have a much better state of mind. Thank you.
Thank you. I jotted down one more question, and then I'll give, if you'd like to type one or raise your hand, this is going to be the last chance. So even as I ask, please feel free to do so. The slide you showed with the statistic about something about 65% say that their connections with their colleagues are stronger working with different technologies from home. Is that question saying because they use technology it's stronger, or they really feel that their connections are stronger working from home? And why do you think that is? Why would you grow closer to your colleagues working remotely?
Yes, absolutely. Actually, it was not a comparison, Rebecca, with the usual connection way. The meaning of this was that while using frequent communication, while doing frequent team meetings on weekly basis, for example, you can also do quiz nights. You can do after-hour parties to your team. By using this technology and by doing it on frequent basis with your team, they have improved the communication with their colleagues. This is what it means. We all remember. Yes, please go ahead.
It was not comparing to when they're all together in the office. It's compared to people who don't do anything with technology. They're just working alone in their homes.
Absolutely, absolutely, Rebecca. And you know, even if you want to compare it, we all know these situations where sometimes on a Friday afternoon, I told one or two of my colleagues, all the week went by, we didn't even connect this week. This week went by so fast, we didn't connect. So while working from home, we had a purpose. We had, I mean, an intention to check in and to connect. And we have launched in Cigna, for example, a check-in campaign where we were checking in. We needed to check in on at least 5 colleagues per week, and it went up to around 20 colleagues per week. And some of us have even checked in on more than 20 per week. And all this was monitored, and there was prizes that were given away to the colleagues who have made the highest number of connections during that campaign, that check-in campaign.
That's really cool. I also really like what you said about the one thing to do with resilience or changing one thing. I'm trying to drink more water, my one thing, but I've heard from others as well. It's another good idea for a campaign. Is this all included in these sort of, you mentioned all the content. Is this accessible right now for those on this call, or is this particularly for your clients?
Yeah, it is, some of them are published, but mainly it is for our clients and members, of course. And this one small change is really successful because, you know, we usually come with this big list of New Year resolutions where you put 20 resolutions and then you don't have the motivation and enough strength to do them. By doing one small change, I want to lose weight. I chose the most difficult one, I know. By quitting smoking, by connecting more, whatever. Everyone, one small change makes it much easier to execute it, Rebecca.
Very good. Well, I think we may end with about 10 minutes left today, which I'm sure if people have meetings right after, they'll appreciate. This has been so helpful. I'm so glad we did it. Thank you for your time. Thank you to your team. On behalf of the OABC, it's been really great, and we appreciate it. And thank you
very much, Rebecca. Thank you for all the participants. I look forward for more events with the OABC. As I mentioned, we are new members, and especially I look forward to be back in Muscat soon and to meet you all face to face, hopefully. Thank you very much again, and
thanks, everyone.
have a great day.
See you soon.
Bye.